If you're pregnant after a loss, you may struggle with mixed emotions like worry, excitement, fear, and joy. Here are ways to honor your experience and celebrate your rainbow baby. Having a baby shower or baby sprinkle. It's not too early to talk to the host about the theme and whom to invite. For inspiration, check out these baby names inspired by nature, outer space, and love. Fingerprints. The skin on your baby's fingers and toes has formed distinct patterns. These fingerprints and toe prints are now permanent and unique, even among identical twins. Your baby's sensory development is exploding. Their brain is designating specialized areas for smell, taste, hearing, vision, and touch. A white, waxy coating called Vernix caseosa is forming on your baby's skin. Vernix has many benefits. It protects and moisturizes your baby's skin, protects against harmful bacteria, and helps the lungs and digestive tract develop. Your baby at 19 weeks. Your baby is about the size of an heirloom tomato. Round ligament pain. As your uterus grows, the ligaments that connect it to your pelvis stretch and thicken. This can cause a sharp, stabbing pain called round ligament pain. The sensation may feel like it starts deep inside your groin and moves upward and outward on either side to the top of your hips. If round ligament pain strikes, stop and rest if you can, and avoid movements or positions that trigger it. Round ligament pain is brief and should ease quickly. Abdominal pain. If you're having abdominal cramping and it doesn't go away with rest, call your doctor or midwife. Also call if the cramping causes severe pain or is accompanied by another symptom like fever or dizziness. Another warning sign: you have pain in the upper abdomen or your abdomen is unusually sensitive to touch, especially when pressure is released. This could signal an abdominal infection. Skin changes. Are the palms of your hands red? It's from extra estrogen. You may also have patches of darkened skin on your upper lip, cheeks, and forehead. That's called melasma, or the mask of pregnancy. Pregnancy hormones act on the cells that contain melanin, which can also lead to darkening of your nipples, freckles, scars, underarms, inner thighs, and vulva. Also, you'll probably see a darkened line running from your belly button to your pubic bone. That's the linea nigra, or dark line. All these changes in pigmentation should fade after pregnancy. 1 in 5 pregnant women have nosebleeds. Due to increased blood volume, pregnancy causes the blood vessels in your nose to expand, which makes them break and bleed more often. This is more likely to happen if you have a cold or allergies, or you're in particularly dry air. If you get a bloody nose during pregnancy, sit down and lean forward while keeping your head higher than your heart. Pinch the lower part of your nose with your thumb and index finger for 10 to 15 minutes, breathing through your mouth. You can also apply cold to the bridge of your nose to constrict the blood vessels and slow the bleeding. Feeling out of breath lately? You're not imagining it. You need more oxygen during pregnancy, and your body adapts by inhaling and exhaling more air with each breath. Plus, later in pregnancy, your breathing might feel more labored as your growing uterus puts pressure on your diaphragm. If you're feeling breathless, pause and rest. But if your shortness of breath is sudden or severe, or you have other troubling symptoms like a rapid or irregular heartbeat, call your provider. Pregnancy checklist at 19 weeks pregnant. Embrace your pregnancy body type. It's possible to find cute maternity clothes that flatter your body type, whether you're petite, curvy, or carrying high or low. The most important style tip of all: make sure you feel comfortable and confident. Think about childcare. It's smart to look into childcare options now if you'll need regular care for your baby. Ask local parent friends for recommendations and search online. If you live in an area where daycare centers are in high demand, go on a few tours and put your name on waiting lists. Plan something fun. Take a moment to enjoy this baby-free time. Some ideas: buy tickets for a performance or live music, go to a late-night movie, wait in line at your favorite Sunday morning breakfast place, or take a day trip nearby. Or go big and plan a baby moon. Improve your sleep. It doesn't matter how determined you are to rest up before your baby comes, your body has other plans. Whether you constantly need to pee, feel anxious, can't get comfortable in bed, wake up hungry, or have heartburn, leg cramps, or just plain insomnia, getting enough sleep during pregnancy can be a struggle. But that doesn't mean you shouldn't try. There are plenty of things you can do to sleep better tonight, from changing what and when you eat or drink to practicing good sleep hygiene and having the right pillow. Connect with other parents. People in the same stage of parenting can be a lifeline. Find a group of non-judgmental parents, whether that's an in-person moms group, a prenatal yoga class, or an online group in the baby center community. Check out your birth club, where all members are due in the same month. or browse our groups by topic. 19 weeks pregnant bellies. Sometimes, expecting moms worry they look more pregnant or less pregnant than they really are. But there's no set formula for how and when you start to show. As long as your healthcare provider says your baby is developing well and you're on track with weight gain, there's no reason to worry.